COVID hospitalizations in the U.S. climbing at an alarming rate. Over 95,000 people infected.
Hello, and welcome to our channel. Here, we make public health simple, clear, and connected to your everyday life. What if the most important lesson from COVID-19 wasn't about a virus at all, but about how societies move, decide, and care for one another under pressure? In a matter of weeks, hospitals strained, borders closed, and daily routines collapsed, forcing public health systems to act at unprecedented speed. In this video, we'll uncover how public health responded. Testing and tracing, distancing and masks, vital messages and dangerous misinformation, vaccines and the race against variants, to reveal what worked, what failed, and the lessons we must carry into the future. COVID-19, short for Coronavirus Disease 2019, is an infectious disease caused by the SARS-CoV-2 virus. The World Health Organization defines it as a respiratory illness that spreads primarily through droplets and close contact, capable of causing symptoms ranging from mild cold-like discomfort to severe pneumonia and even death. But what does that really mean in everyday language? Imagine a virus that behaves like smoke in the air. It moves invisibly between people, drifting through conversations, crowds, and shared spaces. For some, it feels no worse than a seasonal flu. For others, especially the elderly or those with chronic conditions, it overwhelms the lungs, weakens the body, and steals lives within days. COVID-19 is more than a medical diagnosis. It is a test of how societies manage risk, protect the vulnerable, and balance freedom with safety. Understanding this basic definition lays the map for why public health became the frontline defense in a crisis that touched every corner of the globe. By the end of 2020, COVID-19 had already claimed millions of lives worldwide. Entire health systems buckled under the weight of overflowing hospitals. Nurses worked double shifts until exhaustion blurred into collapse. Families were separated, businesses shuttered, and classrooms emptied into the glow of laptop screens. The numbers themselves are staggering. In the first year alone, over 3 million deaths were officially recorded, though the true toll was likely higher. Beyond death, millions more carried long-term scars, lingering fatigue, damaged lungs, and the shadow of long COVID that reshaped daily life long after the initial infection had passed. But numbers only tell part of the story. In Italy, cities like Bergamo watched funeral processions stretch day after day, a grim rhythm of loss. In New York, refrigerated trucks lined hospital parking lots, transformed into temporary morgues. In India, families scrambled for oxygen cylinders, each breath a reminder of the fragile line between survival and despair. These moments remind us that COVID-19 was never just about a virus. It was about systems pushed to the breaking point, about communities forced to adapt overnight, about individuals whose lives became symbols of resilience or of tragedy. Public health became the bridge between chaos and survival, showing why the principles we study in textbooks matter so urgently when the world itself is on fire. When COVID-19 erupted, public health responses formed the backbone of humanity's defense. Each measure came with urgency, compromise, and lessons etched in both success and failure. The first shield was testing and contact tracing. Countries like South Korea and Taiwan mobilized laboratories and digital systems almost overnight, mapping outbreaks before they spiraled. In contrast, places where testing was delayed found themselves chasing shadows, the virus spreading faster than the systems designed to track it. Next came social distancing and lockdowns. Empty streets in London, shuttered cafes in Paris, silent subways in Tokyo, these became the new symbols of resistance. While such measures slowed the spread, they also deepened economic wounds and triggered debates about personal freedom versus collective safety. The balance was fragile and the cost was heavy, but without them, hospitals would have collapsed entirely. Then there were masks and public messaging. A simple piece of cloth became one of the most powerful and controversial tools of the pandemic. Nations that embraced consistent mask wearing saw sharper declines in transmission. Yet inconsistent guidance, fueled by political divides and misinformation, eroded public trust. The pandemic showed that communication is as vital as medicine. Words can save lives or cost them. Finally came the race for vaccines. In record-breaking time, multiple vaccines emerged, proving the triumph of science under pressure. Millions were protected, hospitalizations plummeted, and societies began to reopen. But inequality cast a shadow. Wealthy countries stockpiled doses while poorer nations waited. The global rollout revealed not only what humanity could achieve, but also the divisions that left many vulnerable. Each of these pillars, testing, distancing, masking, and vaccination, formed chapters in a global story. Together, they reveal both the power of coordinated public health and the dangers when preparation falters.
Not all nations fought the same battle in the same way. Some turned the tide early, while others stumbled under the weight of hesitation and denial. In New Zealand, swift border closures, strict quarantines, and transparent communication nearly eliminated the virus in its early waves. Citizens trusted the guidance, and for a time, life inside the island nation continued almost untouched. South Korea, with rapid testing and digital tracing, demonstrated that outbreaks could be contained without prolonged lockdowns. These countries became proof that decisive action, rooted in public health principles, could spare countless lives. Contrast this with the United States in early 2020, where delays in testing and fractured messaging left the population confused. Political polarization turned masks into symbols of division rather than unity. Case counts soared, hospitals overflowed, and trust in institutions eroded. Similarly, in parts of Europe, reopening too quickly after initial lockdowns triggered devastating second waves. Vaccine rollout became another line of division. Wealthy nations administered booster after booster, while much of Africa and South Asia struggled to secure even first doses. This inequity was not only a moral failure, but also a strategic one. Variants emerged and spread precisely because large populations remained unprotected. The comparison is stark. Where leadership aligned with science, where communication was clear, and where collective responsibility outweighed individual reluctance, the impact was softened. Where hesitation, mixed messages, and inequity ruled, the virus claimed its heaviest toll. These contrasts etched into history remind us that pandemics are not fought by science alone. They are fought through governance, solidarity, and the will to act swiftly. COVID-19 was not the first pandemic, nor will it be the last. Its legacy lies in the lessons we choose to embrace or ignore. First, transparency saves lives. Where governments shared accurate, timely data, citizens acted with greater trust. Secrecy and denial only allowed the virus to spread in silence. Information is not just numbers on a chart, it is a lifeline in the fog of uncertainty. Second, investment in health systems is non-negotiable. The pandemic exposed brittle infrastructures, hospitals short on ventilators, supply chains starved of protective gear, and communities left without access to care. The next crisis demands stronger systems, resilient supply networks, and a workforce ready to respond without burning out. Third, equity matters as much as innovation. Vaccines developed in months were a miracle of science, but distribution revealed the fractures of inequality. A virus does not respect borders, and leaving vast populations unprotected ensures that variants will always return. Global solidarity is not charity, it is survival. Fourth, communication is a public health tool. Mixed messages fueled confusion, conspiracy, and resistance. Clear, consistent, empathetic communication is as critical as the vaccine syringe or the test kit. Words carry the power to mobilize or divide. Finally, preparedness is the only true defense. Stockpiles of equipment, robust surveillance systems, and international cooperation cannot be afterthoughts. They must be permanent fixtures, rehearsed and ready, because the question is not if another pandemic will come, but when. These are not abstract lessons. They are instructions written in the losses of millions, a debt that demands we act with wisdom the next time the world trembles. The story of COVID-19 is not only about a virus, but about how humanity responded under fire. We saw the strength of testing and tracing, the necessity of distancing and masks, and the transformative power of vaccines developed at lightning speed. We also witnessed the dangers of delayed action, mixed messaging, and the deep scars left by inequity in access to care. At its core, the pandemic taught us that public health is not an abstract theory. It is the difference between resilience and collapse, between lives saved and lives lost. The principles written in textbooks became the battle lines of everyday life: transparency, preparedness, solidarity, and trust. Remember the hook. This was never just about a virus. It was about choices, political, social, and personal, that decided the scale of loss and the speed of recovery. If these lessons fade, history will repeat itself. If they endure, then the sacrifice of millions will not have been in vain. Thank you for watching and for being a part of a community that values knowledge and resilience. COVID-19 changed the world, but it also reminded us that public health is everyone's responsibility. By learning from the past, we prepare for the future. If you found this video insightful, don't forget to subscribe and share it with others who care about building a healthier, safer world. In our next video, we'll dive into how outbreaks are tracked and controlled through the science of epidemiology, a behind-the-scenes look at how data and detective work save lives. Stay informed, stay safe, and remember, the choices we make together shape the health of generations to come.